Thanks for inviting me to this program. I think what we have realized as an institute is that we don't have to be sort of a receiver of solutions from other places, but we actually have to be proactive and participate in creating solutions for our own problems and for the global world at large. So one of the things, since you have just mentioned about the vaccine situation, is one of the things that is actually interesting for us is actually, can we really, have an activated effort where we can actually develop a framework whereby we can even develop vaccines internally. And here, because I have a background in RNA biology, so I wasn't surprised. I've been following, like, you can actually make these vaccines for messenger RNA like CureVac and all the other companies that have done so. And we would like actually to participate and actually not wait for COVAX and whatsoever and say, okay, Africa should get a share, but actually to say Africa should be actively researching and actually offering alternative solution for this kind of problems. But in this health sector, I think we even go more so and say, okay, fine. We have even in the Zimbabwean situation, traditional medicines that have been sort of said may have actually, may have some prophylactic effect against COVID-19, for instance.
Right.
And we would like to actually go into dedicated research to actually see, can we really have some scientific justification whether there is something to it, and whether we can turn such knowledge into patentable or some really worthwhile scientific appeal or a prophylactic, something that you can trade in a pharmacy with a proper study and even actually distribute it to the rest of the world. So this is just give it sort of a shorter framework what we are trying to do in the health, and we even go further than also to provide a vast array of laboratory testing services, because we had a very big shortage of testing services in Zimbabwe for COVID-19, for instance, and other diseases. We do a host array of diseases for laboratory testing. So we provide a host array of bioanalytical services, including I think other salmonella or other fight against sepsis, which is a big problem in Africa, or some gynecological problems related to that. So this is sort of the framework in which we operate. This is just a summary of a much bigger picture.
I want us to expand a bit on that. So your Biotech Institute has come up with an effective way to tackle the COVID-19 pandemic when it comes to testing. Just tell us a bit more about that.
Yeah, so we, during my time in Gemini, we have managed to actually have some partners. We have, I think it was in England, but we have actually had some of their partners in Germany, and they developed, I think an RT lamp. So it's just like RT PCR, but much faster. So we have the capacity to test, I think, for COVID-19 within like 35 minutes. So people usually come here, can actually get swabbed, get tested for COVID-19, get a result and leave. So it's much faster, because the whole response about all these things is like, can you test people fast enough to prevent the spread of it? So this is a system that we're working with, and it's also very small and very portable. So it's battery powered. So, this is the kind of that instrumentation that one requires in the African society. That if you have a power loss, you can still operate. And I think it is more and more that we have to go in this direction, so that, if people want to do a concert or whatever going forward, people can just get tested, and then right away they can start whatever they want to do, or these sort of social activities, because at some point, I think life has to resume for many people.
Now, as mentioned a short while ago, you are a molecular biophysicist by profession.
Yeah.
How has this influenced your work at Biotech Institute, and how are you using the skills that you've acquired to find solutions to what some may argue is a health services crisis in Zimbabwe?
So I think I have a very peculiar background. Actually, right now, if you say, I think what I had in labs was actually a professor of physics, pure physics, but I actually come from the direction of biochemistry. And I consider myself a physical chemist, biochemistry, so I can really, cross, I think, sort of interdisciplinary work from biochemistry, biology to actually rigorous physics. Because I used to teach physics in Leipzig, and this has given me sort of the spectrum, sort of the necessary framework whereby if you are going to do a comprehensive research and understanding in the African society, you usually lack sort of partners. So usually, if you're a pure physicist, you need a very good enough biochemist, or you need a good enough physical chemist. So I think because I have a broad background, I also can program. So this has helped us sort of to understand the latest technologies, because I was also involved in a group which was working with single molecule biophysics, which is like a fancy term in Europe and in the rest of the world. So I have managed to be able to handle instrumentation. I can actually repair some instrumentation to some cases. I actually have a programming background, so we have developed actually our own software for COVID-19 testing, and to produce secure QR codes with our own servers, our own databases, and we're even trying to offer to government to produce secure vaccine certificates. So you need sort of this whole spectrum to know the technology in terms of instrumentation. You need to know also what it means in terms of biology, what are the limitations of biology, what you're trying to understand, what you're not trying to understand, how to maintain the instrumentation, how to maintain your supply chains. So you need this whole sort of broad understanding that you need. So I think in this way, I think sort of my interdisciplinary sort of background prepared me for this kind of work. Otherwise, alone it would be very difficult. You always need many different partners to perform.
Now, as you continue to track your journey, after your professorship in Germany, you returned home in August of 2020 and set up what may be Zimbabwe's first privately owned research institute. I want to speak about the exact nature of your work and research done by your institute. Since the outbreak of COVID-19 and since it was first detected in Zimbabwe, what would you say are some of the significant findings that you have discovered as a research hub, which is linked to this pandemic experience in that country?
I was still, I would say, I think this is a slight correction. I think I was still affiliated with Leipzig, I think in August 2020.
Yeah.
I really finally took my leave, I think March 2021. So, I was just setting up, I think, putting all the wheels in motion. And within a short period of time, in science, in less than 6 months, you don't really get any, what's a significant finding, I would say. But what we have done is really to prepare sort of the background or the framework within which we can really operate, to hire the right people, to get set up. You need to have all the systems operational, the right people. You train the people to be at a certain level that they can really understand and push forward. So we need to, to procure a lot of materials and so forth. So right now, what we have said we have done is really, we have said we have different topics that we want to work on. And the most advanced right now is we have people that are trying to work on CRISPR-Cas biology. And this is really, we're trying to really regulate some RNA in the cells. What you do is usually diseases, genetic information is usually transmitted in the form of RNA kind of a signal. And instead of changing the genetic material, you can actually just change the information transfer. That way you don't create any GMO organism, but you can actually, for instance, in diseases like cancer, prevent the production of a protein that actually causes the disease by just manipulating the information transfer. So we have actually now sort of preliminary work that we're doing in that regard. And we have another project that is going in the direction of enzyme biotechnology, whereby a postdoc who just recently arrived is really trying to develop some enzymes that basically can increase the phosphate content in animal feeds. People usually, some animals cannot really access the phosphate because it's locked up in a particular or special chemical form. And you have some proteins or enzymes that can sort of unlock these phosphates, and then this can make sort of nutrient content actually increase. Otherwise, people right now are basically mining for phosphates and adding them into feeds, which is a very environmentally degradative process. I think these are two projects that we say are fully advanced. And we also have a little bit that we are doing is sort of in antimicrobial resistance, but we want to really, and we have really established, because we want to do a lot of bioinformatics, so we have created the cooperations with the Supercomputing Center in Zimbabwe. And this is now the direction that we are going, because we want to understand what does it mean at a sequence level to have a resistance to a particular drug? What does that mean at a protein level? And can we then look for drugs that combat this? So we don't want to just to collect samples and send somewhere to get answers to it, but we're actually trying to do a research from the beginning to the very end. So this is we're doing a lot of preliminary work, but I cannot tell you we don't have any sort of in a very short time frame that we have been operating. You cannot really say you have any substantial findings.
So as we wrap up our conversation, global health experts have also warned that if the COVID-19 virus continues to spread unchecked, it will continue to mutate and produce more variants. It has also been described as a race between variants as well as vaccines. What would you say it would take for the vaccine to win this race?
Well, yes, I think it's a very sort of logical or intuitive process that people really put their faith mostly on vaccines, because is the quickest thing you can produce, and is sort of the most you get it correct at the very instant. But I think vaccines alone won't be the answer to this problem. I think there need to be dedicated research on what may be treatment solutions. I think we just don't have, because vaccines you have to be continuously to be injected at every point in time. But I think we need a more dedicated research to also look at treatment and prophylactic options, so that we have a comprehensive strategy on how to do with this thing. Otherwise, I don't see it as a long-term strategy that we need to be vaccinated every couple of months.
And are you in any way satisfied with the pace of rollout of vaccines in Zimbabwe, considering that there have been these protests in recent days where people have taken to the streets demanding a vaccination?
Well, I think I understand sort of the frustration of everybody on the street to want to get vaccinated and move on with their lives.
Yeah.
At the same time, as somebody in the health sector from the other end, and also understanding it is very difficult to procure vaccines. I think Zimbabwe is actually one of the countries that has actually done well, because they basically skipped all sort of the American-made and the European-made vaccines that have actually made so many problems. Like in Germany, there was a big problem that the delivery for AstraZeneca, for instance, was way lower than what was expected. Like the EU is suing AstraZeneca. So I actually think at a certain level, Zimbabwe has done well. And in the pandemic, of course, it could be better, and maybe it could be much better. But I don't know what's going on behind the scenes, because I'm not in the government. But I think I definitely understand the frustration that people want to move forward with their life, and more vaccines, and so forth. But I also think the government, relative to what has been actually in other countries, they've done fairly okay. And then our numbers here in Zimbabwe have been very low. So I think to some extent, I think they've been trying to manage the COVID situation quite okay.
Well, Brighton, thank you very much for that insightful chat. That was Brighton Samatanga, the founder of Biotech Institute, talking to us about his private research institute and efforts to strengthen Zimbabwe's healthcare system.